As a reminder, this is a picture from the main dormitory, taken after the lockdown in that country. Same thing, these are places with lots of people in close quarters having heavy social interactions that likely include lots of talking. Migrant workers in their room at the Westlight To Guan dormitory in Singapore. Photo, EPA. Source, South China Morning Post. As you can see, the spread might not have been their fault, but rather an unavoidable consequence of their living conditions. The brutal spread of coronavirus at social gatherings includes many other such examples. One is a choir in Washington state, where people sing loudly, close together, for a long period of time. 45 out of 60 people fell sick. Over 4,000 people were infected across Europe through what might be a bartender in Ischgl, where après-ski events are common. Trofana Arm, an après-ski at Ischgl, the German area around Ganjult, suffered 1,500 infections after a carnival, where people commingled, talked, sang, and kissed each other on the cheek. This is an image of the event. Source. Photo, Heinz Eschweiler. The other biggest outbreak in Germany was also due to a festivity. The German district of Tirschenreuth, with 600 cases, has the most cases per capita in the country after festivities to celebrate beer. The list keeps going. At Bondi Beach in Sydney, at least 30 people became infected after attending a crowded dance party the night before. Gatherings of 500 people or more were banned. In France, a 4-day celebration at the Porte Ouverte Christian Church gathered 2,500 worshippers, infected many, and seeded outbreaks across the country, including 250 people working at the Strasbourg University Hospital or 263 cases in Corsica. A soccer game in February between Italy's Atalanta team, from Bergamo, and Valencia, from Spain, seeded what later became Bergamo's outbreak, one of the biggest in Italy. Even in Seoul, South Korea's capital, which has some of the best coronavirus management in the world, 2,100 bars and clubs closed in the middle of May after a single infected person visited 5 clubs over a long weekend, infecting at least 100 so far. Over 1,900 contacts are currently being traced. This is not limited to massive celebrations. Weddings, funerals and birthdays generated 10% of early spreading events in the US. For example, this man from Chicago infected 16 other people at a funeral and 3 of them subsequently died. This makes sense, since people at these types of events often spend hours together, touching one another, hugging, talking. In this 50-person party, over half got infected, and these individuals then spread the virus across the US and the world. These super spreader events also happen in the business world. At least 115 meat processing plants have had outbreaks in the US, affecting at least 5,000 workers. Packing plant workers, USDA. Source. A Biogen conference in Boston in early March caused around 100 infections and spread the virus to 6 states. At a fish factory in Ghana, one worker infected over 500. And it's not limited to blue-collar work. An call center worker infected around 100 co-workers, approximately 45%, in South Korea. Source. Say goodbye to the open office. All around the world, we see the same pattern time after time. Close proximity, social interaction, singing, talking, dancing, hugging, kissing, all for long periods of time in a confined environment. A pattern consistent with the model that most infections happen through droplets or droplet clouds while coughing, talking or singing. We have not heard of outbreaks coming from movie theaters, for example, where people are mostly silent and stay in one seat the entire time. A scientific paper, preprint, led by Carl Juneau, Ph.D., I'm a co-author, reviewed hundreds of other papers. For the flu, the evidence was mixed, but it looks like the type and timing of events mattered. What we found was that the flu is more likely to spread in events that are long, crowded, and indoors. Another study suggested that, for flu, limiting mass gatherings was only helpful just before or at the beginning of an outbreak but would have little effect 20 days after the infection peak. Here are some relevant quotes from more recent publications. The best available evidence suggests multiple-day events with crowded communal accommodations are most associated with increased risk. Mass gatherings are not homogeneous and risk should be assessed on a case-by-case basis. Noonan and Brasi, March 2020, Oxford University, not peer-reviewed. Results demonstrated that event cancellations can reduce COVID-19 infectiousness by 35%. Sugishita et al., March 2020, not peer-reviewed. Ferguson et al. From the Imperial College believe the impact of limiting public events is a reduction in the transmission rate of around 12.5%. With all this evidence, it's clearer and clearer that the coronavirus loves social gatherings and crowded spaces. For those of us who love feeling part of a large group and meeting new people, we might be forced to say bye to them for the next few months. This is especially true if we are meeting lots of new people. The Social Network, another paper, looked at how infectious diseases actually spread in social groups. The bigger the group, the faster the infection spread to the entire group. Let's look at the green line that says n equals 20, which represents a group with 20 people. This line shows that, as the transmission rate of a virus increases, so does the share of individuals in the group that become infected. And it does so faster than the normal population, the bottom dotted line. However, a group of 100 people will get most of them infected, even with a low infection rate. Let's compare a music concert with 10,000 people with a classroom of 20. In the concert, there's a higher probability that at least one person is infected than in the classroom. On top of that, each person will interact with many more people, whereas in a classroom it's capped at 20. And on top of that, the people in the music concert don't know each other. They come from very different social groups, so the virus will then spread across all these groups, and these people will take the virus back to their groups, infecting them. Conversely, in the classroom, since it's always the same group meeting, if somebody gets infected, the infection largely remains contained in that group. Big events are not just worse than small events. They are much, much worse. Over the next few months, better research might shed light on exactly how much different social gathering events are impacting the spread of the coronavirus. In the meantime, what we can guess is, social gatherings should be avoided if a lot of people are close to each other, sing, talk a lot, or commingle. Indoor, confined areas are much worse than outdoors activities. Time matters. A short time is probably okay. Hours probably not. Mixing different social groups is especially bad. Conversely, small outdoors events where people don't talk or interact are probably safe, especially if combined with measures such as masks, physical distancing and hygiene. How can we use these insights to decide what types of events to allow? Social gathering restrictions prevent spreading. We can establish some rules of thumb. For example, cinemas or classical music concerts are probably much safer than rock concerts. In the first ones, a limited number of people are sitting close to each other but barely interact and don't talk. They can also use masks if needed, and maybe be seated 6 feet apart. In a massive rock concert, it's hard to not sing, move about, or interact with lots of people around you. Schools or small business meetings with the same people over and over are much safer than big fairs, travel for work, or big sports events. If somebody gets infected in the school network, many members might get infected too, but at least that doesn't spread to many other places outside of that network. If you have a wedding coming up, either cancel it, postpone it, or have a small ceremony in open air where people wear masks, don't hug each other, and avoid talking as much as possible, especially from up close. Since doing all that would be very hard, it's much safer to postpone it. In any case, if you do hold a wedding event, tell grandma or your diabetic cousin that you love them very much but that they really should not come physically. It's a poor substitute, but under the circumstances a video conference is their only safe option. All of the above are early conclusions based on current, but scant, evidence. These conclusions will change. But with them, you can picture how risky an event is. What we're trying to do is get to a place where we can estimate how many infections will happen at that event. Note, all these numbers are guessed based on everything I've read. I'm sure they're wrong. However, these are the decisions we're making today, educated guesses. I hope this will spur new research quantifying this properly. This table tries to assess how many infections could be caused by different events. We can see that watching a movie in the cinema might cause only 1 infection, while holding a big fair might cause 20,000. This is only one side of the equation, the cost of allowing social gatherings. The other side is the benefit. The cost-benefit of social gatherings. Once you have the cost per event, your infections, you can calculate the benefit per event, and finally compare everything apples to apples. Once you have a version of this that reflects reality, you can reach many conclusions. Are events worth allowing, based on what we know about costs and benefits? For example, in this model, the opera has a value of $33,000 per infection. That is the highest value per person for any event, again, surely wrong. This is illustrative. But what's the cost per infection for society? If we establish based on our healthcare system that the cost is only $10,000 per infection, then we should allow the opera, theaters, cinemas and big conferences and congresses, but we shouldn't allow events like big fairs or music concerts since their value is below $10,000 per infection. How can we account for value that goes beyond strict monetary value, such as psychological, ethical, or legal value? How does that change with changes in prevalence? What is the prevalence at which I can start opening events? How does that change per region? Can I open up events in areas where there are very few cases? At what point in the prevalence can I open up what types of events? How can I influence the risk of every type of event? Can I enforce mask wearing? Can I force people to only interact with a few other people? How do these values per infection compare to those from tourists coming to your country? Allowing these events might be more worthwhile if intelligent measures are taken. For example, if scanning a QR code is mandatory to enter an event, and people need to have Bluetooth enabled at all times to register who is close to whom, if we later discover one person was infected, we can trace all the other people at the event that were close by, contact them, test them, and isolate or quarantine them. If there are temperature checks at the entrance, this can reduce the number of potential infections entering, but probably less than half. If you can succeed at making people wear masks, your event might become acceptable. Perfect is the enemy of good. Why an imprecise framework is needed? This might sound awfully hard and imprecise, so it's worth pausing for a moment, take a step back, and realize why we're doing this. Most decision makers are guesstimating all of this. Even if they don't do the math formally, they are doing this calculation in their heads. The only thing we're doing is extracting it from their heads and allowing people to debate it through a common language. When a group of scientists and politicians gathers to decide what size of crowd they will allow, what conversation do you think is happening? It's a cost-benefit, but they might not realize it. If we ban events above 1,000 people, we're banning lots of sports, fairs, and music events. That's hard. Yeah, but these are the events that cause the most infections. But what about all the jobs that we're going to lose? Think about all the deaths you're going to prevent. The value of formalizing into a cost-benefit is not to be precise. Precision is impossible with the data we have. The value is to put all of our biases and pieces of data and knowledge and insight and goals and problems and solutions in one single place, in front of everybody, with one common language, so we can all discuss it and reach the best guess on what's most valuable to allow for society. Which businesses should we open or close? Researchers are already applying this approach to determine which businesses should open first. Source. Notes: danger is calculated taking into account the number of visits, the number of unique visitors, and person hours of visits above 2 density thresholds. So banks are quite safe because few people visit, those who do tend to be the same all the time, and they don't spend a lot of time. Conversely, lots of different people go to gyms and cafes, and they spend a long time there, in the case of cafes, talking a lot face to face. The importance comes from a combination of how much people care about different businesses based on surveys, and how much wealth they generate based on employment and receipts. Note that this model isn't perfect because it doesn't account for face-to-face conversations or singing. Further models should account for that, and ideally for other things such as empirical evidence. Based on this analysis, which looked at real-world data such as mobility, consumer preferences, and government statistics, banks and grocery stores are the most important to maintain open, while gyms or cafes should remain closed and be the last to reopen. It is not perfect, but it gives a broad priority for the order of reopening. If they were closed, banks, finance companies, grocery and general stores should be the first to reopen. After that, reopen department stores, colleges and universities, clothing and shoe stores, and auto dealers and mechanics. Next would come furniture and home goods stores, electronic stores, barbers and salons, hardware stores, places of worship, casinos, office supply stores, and movie theaters. Next come amusement parks, bookstores, museums, pet and supply stores, and liquor and tobacco stores. The last to open should be sporting goods stores, gyms, cafes, and dessert parlors. Interestingly, the analysis confirms the types of businesses that countries have already prioritized intuitively, even with imperfect data. Models like this are not perfect yet. For example, I disagree with their conclusion on eateries. It's true that fast food restaurants should open before sit-down restaurants, since people stay for much less time and talk less, but this paper suggests we could reopen some of them at full capacity early on. That's because they don't account for the huge danger that is added in eateries of people sitting face to face for long periods of time. They also don't account for creative ways businesses could adapt to reopen safely. Gyms, for example, could limit attendance, reorganize floor space, require people to maintain a 6 feet distance, and/or have someone on staff keeping all spaces clean full-time, like in this gym. Businesses could also impose stronger restrictions during exclusive business hours for older clients. This is just an example, and in the end, the broader question might not be which businesses should open, but rather, how can businesses reopen safely? Families and transit in China. Outside of Hubei, around 80% of infections involved families and close contacts in the household. This is surely an effect of home quarantines, since mass gatherings were limited. But it illustrates how much the virus spreads in families. Among these contacts, the highest risk by far is transmission to spouses. 28% of them end up infected, compared to 17% for other adults in the household and just 4% of kids below 18 years old. Nevertheless, we can probably draw conclusions that are applicable elsewhere. Stopping infections at home can have a dramatic effect on the epidemic. You are not very likely to catch the virus from random people on the street. You are, however, very likely to catch it from your spouse, your kids, your parents, or the friends you visit. Transit also has an impact, although it's unclear if it's due to traveling with family members or caught in transit from other people. So treat your family members with caution. Try to avoid interacting physically with members that are at risk. Call them instead. If somebody has symptoms, try to isolate that person. It's hard to do that with a family member, but the alternative can be more sickness, a visit to the hospital, or death. So if there are symptoms, avoid kisses, hugs, or even talking face-to-face without a mask. Thank you, Dr. Mujcevic, for your roundups of papers. What about schools? The role of children in the coronavirus epidemic is unclear. How likely are they to get and pass on the coronavirus? How does it affect them? On one hand, it looks like they are infected less frequently, and when they are, they don't die of it or infect other people much. As a result, it looks like school closures would only have a small effect on limiting the spread of the virus. On the other side, we're not sure, because most countries closed them, so it's hard to compare, but there are some emerging news of children with special symptoms, and some outbreaks are reported at daycares.